Hi, my name is Maria Frias, and I am an RN52, and I will be talking about the 4 stages of labor. In stage 1, which is the early labor, it is broken down in 3 phases. The first phase is the latent phase. Is the onset of labor, lasts about 4 to 6 hours. Cervical dilation is about 1 to 1.5 centimeters per hour. There is some effacement. Mothers usually in this phase are a little more excited, more talkative. In the second phase, which is the active phase, lasts around 2 to 3 hours, has a more rapid effacement and dilation. It goes from 4 to 7 centimeters in dilated, and then the fetus starts to descend. Mother becomes anxious and starts feeling more restless. In this phase, patients would go to the hospital usually. The third phase is the transition phase. This phase can last between 20 to 40 minutes. Contractions are stronger, are about 2 to 3 minutes apart, and contractions are lasting about 45 to 90 seconds. The mother is becoming more tired and irritable. They can experience some nausea and vomiting and have the urge to push. They feel some rectal pressure, feels like they have to have a bowel movement. There's an increased blood show. Fetus's head can be crowned, and this leads to stage 2, which is the delivery of the baby. In stage 2, the mother is in full effacement and dilation, so she would be at the 10 centimeters. This stage usually lasts 30 minutes to 2 hours, depending if you've had deliveries prior or not. Contractions are every 1 to 2 minutes. At this point, the mother can start pushing until the birth of the baby. And then stage 3 is about 5 to 15 minutes. Contractions continue till there is a delivery of the placenta. Could be in Schultz presentation, which is the shiny fetal surface seen first, or Duncan presentation, which is the dull material surface placement seen first. And then you just assess the placenta and the umbilical cord, make sure that it's all complete and there's nothing missing. Then we move on to stage 4. This is the recovery phase of the mother. They can last 1 to 4 hours, depending on the facility, their policies and procedures. Vital signs are taken every 15 minutes on the mother for the first hour, and then every 30 minutes for an hour. Then you just follow the facility policies. Then you assess the fundus, check the lochia, the amount they have, and the color that they're having. Monitor their urinary output, and then do a fundal massage if they are bleeding. And then in this stage, you want to encourage maternal and baby bonding. So usually you could have them put body to body, so then they can have their skins together. So these are the 4 stages of labor.